Don't wait until the problems really become dramatic before you start looking. If you're taking care of somebody with dementia at home, it is a good idea to begin to look early. I even had a patient who, wandered off of the house and they didn't find him for like a couple of days. And I think that those feelings of betrayal, of guilt, of grieving, so many are very real, and they're not easy to navigate. Welcome everyone to the Dementia Doc podcast. I am Dr. Miguel Rivera, and for the past 20 years, my medical practice has been dedicated to the management of those with dementing illnesses. I am joined, as always, by my wife, Ganga, and today we're going to discuss when is the right time to make that difficult decision to place a loved one with dementia.
Miguel, let's start with the situation when some of your family members calling you with some issue, and what would make you to advise them, hey, maybe it's time to look for a facility? What are the key signs, or maybe the main sign?
Well, I think that the main sign is always safety. And that is, of course, safety of the patient with dementia. And so things like, are they wandering? Have they left the house and wandered off? Um, Maybe is their cognition worse and they just left the stove on? So things like, is the safety of the person with dementia compromised? So that is number one. And then number two is the safety of the caregiver or the person who is involved in their care also compromised. Are they experiencing caregiver burnout? Are they not sleeping at night? Are they depressed or not being able to function well because of the immense responsibilities that come in being a dementia caregiver?
If we take the first one, safety of the person with dementia, do you usually advise people to anticipate? Like, let's say if they may be wondering, is it usually that maybe they left the house and all of a sudden the police had to find them and that's the sign? Or you try to anticipate and you notice, I don't know, what are the signs to anticipate that it doesn't take such a major event to make that decision?
Well, sometimes, unfortunately, it does take, such an event. But, you can anticipate, for example, if your loved one is exit seeking, if they are constantly trying to get out, going for the doors, trying to unlock them, constantly trying to escape. That is a big, let's say, red flag. But, I've had multiple patients where that was not necessarily the case. And all of a sudden, the spouse woke up from a nap or they got back from the store and their person with dementia was nowhere to be found. I even had a patient who, wandered off of the house and they didn't find him for like a couple of days. And they found him in a ditch off of the side of the road. So, with lots of bug bites and dehydrated and so, sometimes the wandering episode may come unannounced and let's say, kind of out of the blue, so to speak.
Did you also have stories of patients who didn't have to have such a major event to happen when they decided, well, it's time to place my family member?
Sure. There are many reasons. I think that one of the really common reasons is agitation, for example. As the person with dementia gets more in the moderate stages of the disease, then their ability to self regulate their emotions may become affected. And sometimes people can get very, very agitated, both physically, verbally. They can strike out, they can hit, they can bite, and even though, many times, for example, I do follow patients who are still at home who are agitated. And many times with medications and other interventions, we can help them to remain at home. But sometimes those things are not available to people in general. And I would say that the number one reason why somebody is admitted to a facility has to do with these kind of untoward behaviors, in particular agitation.
So I remember from your practice, you also had episodes when a husband woke up in the night and tried to choke his wife
Yes.
because he didn't recognize her.
Hmm.
Um, and I'm asking all of those questions thinking, if I'm a family member, I assume it's very hard to see maybe at this time. Those major events that the person leaves the house for 2 days, which I can't even comprehend. I mean, I can't imagine the stress levels of not being able to find your loved one with dementia for 2 days. Or if your husband tries to choke you because they don't recognize you, they feel you're intruder in the house. Those are really red flags. But there's probably so many other signs that it's hard for caregivers to recognize. And maybe even the question needs to be what prevents us humans to see that, hey, maybe it's time before it reaches that type of emergency?
Well, I think that perhaps the first thing that comes to mind is that unfortunately many times the caregiver, and of course I think about my mom, taking care of my dad. Um, Many times the family caregiver, the spouse in particular, maybe the involved children, may think that they are the only ones that are uniquely capable of taking care of their loved one with dementia. That outside of the sphere of the family, that nobody can do a good job in taking care of them. And even though, yes, I think in general, the statement that the person with dementia in general does better at home with family care, but to say that that is the only thing that is true is probably not accurate. And you know, the issue with my mom, for example, she made a promise to my dad where she said, no matter what happens, I am never going to place you. I am never going to put you in a facility. And my gosh, it didn't matter what we told her and how many facilities we visited, it was just impossible to get her to consider that. And as you know, she kind of paid dearly for that. By the time that my dad passed from the repercussions of the Lewy body dementia, she was completely and totally exhausted. She had lost a significant amount of weight. She wasn't sleeping. She was depressed. She started to fall. She hit her head. She ended up with a brain bleed, 12 days in the ICU, brain surgery, rehab, and actually ended up losing her independence, right? She couldn't, remain at home anymore because she was just no longer capable of taking care of herself independently. So when we make that warning, that caregiver burnout is real. It really is. It's not just people making up stuff, but the repercussions and the things that can happen as a consequence are real for sure.
It reminds me what Pat Gutman said, and you can click over here to watch that interview. And the caregiver, one of your family members, and when she said, you may think that you're the person who can provide the best care for your loved one. And it's true because you're their family. But that also requires the realization that you need to be taking care of yourself. Because if you're not taking care of yourself, you cannot be taking care of your family member, even when they're in the facility that you can be visiting or just still being part of their life. If you're burnt out, you can't do that. And I think it's true for caregivers, but I would think even when I hear younger people, entrepreneurs, nobody really picks up on the early signs of burnout till they just can't get out of bed or something major happens due to burnout. And as you pointed to your mom, there is also that whole thing of I'm betraying my loved one. I think there is a certain sense of guilt So maybe what can you say? How do people approach that sense of guilt to still make the decision that, you know what, maybe it's time and it would be the best decision for them, even though I understand that home is home. But at this point, it would be the best decision for my loved one's sake and for myself.
Boy, that is a tough one. It is a tough one to address. Again, I'm thinking about my mom again. And I remember realizing that she was getting into caregiver burnout and telling her, Mom, you need to take some time for yourself. Please just go outside, go by the community pool where they live. Go out there, take a book, please relax. Try to go out, once or twice a week with some of your friends. But it was very, very difficult to get her to do that. She always insisted on being at the house, even when she finally agreed that she needed some help. Like, for example, of course, I know you remember the incredible efforts that it took from our part just to get her to accept the idea of bringing in some private caregivers and bringing in some people who could help her, change my dad and bathe them and help them with the activities of daily living. I mean, even that was a monumental step. But even when the caregivers were at home, she still did not want to relinquish the idea of being there and making sure that she constantly, was there to observe what was happening and to solve any problems. So I think that um, it is not an easy thing to overcome the idea that we are the ones that are the best providers, for care for a loved one, and also to overcome the issues that may come with guilt, with grieving, that can come with our with the progression and the deterioration of our loved one with dementia. I think that it's probably a good idea, of course, to enlist other members from the family. If there are children or siblings or anybody who can, um, try to influence the person and try to help them see the situation in a more accurate way, perhaps, kind of a little bit of a reality check. Well, this is what's really happening. Um, I think that in general, this is one of the really, really tough decisions to make, and it's definitely not easy. Unfortunately, there's no easy answers.
Yeah, and I think there's also a cultural context, as we discussed, that in your culture, in Latino culture, it's not so acceptable to say, hey, I'm going to place my loved one. I would say the same is true for Russian culture. I don't know how much it's changed right now. But when I was a kid, my great grandmother had dementia. And I do remember my grandmother saying, there is no chance I'm placing my mom, and sorry for the language, into that shithole.
Yeah.
Which part of the trouble in Russia that they didn't have good facilities. I don't think they even have them today. So, and we lived in an apartment with gas stove, and my great grandmother sometimes would stay there all alone by herself because everybody worked. I would go to school. And I remember coming back from school and I would ring the doorbell and she would come over and say, who's there? And I would say my name. And she said, I don't know, everybody's at home. And she would not open the door. So it was a usual occurrence that I think we even had to tweak the lock a little bit so that she doesn't press the button that locks the opportunity to insert the key and I could open the door. But the fact that she could have just left the house also or fell, all of that was on the table. But there was not even, I think, a good place that my grandmother could have a feeling that, maybe she would be better there. And maybe even if there was a place, I think that still my grandmother would have felt, no, I'm betraying my mom, just placing her somewhere.
Yeah. Yeah, and I think that those feelings of betrayal, of guilt, of um, grieving, I mean, so many are very real, and they're not easy to navigate. So
Yeah.
I know that, in general, as the dementia progresses and the person begins to move from the milder stages of the disease to the more moderate stages, this issue with behaviors, the issue with worse cognition, the issues with less ability to assist in their activities of daily living, and even to actually refuse activities of daily living completely. Like, for example, refusing to bathe is something that we commonly see. Oh no, I already took a shower, you know, or I'll do it tomorrow, and then the weeks and weeks and weeks go by, and the person will not participate in their personal hygiene, and then as a consequence may get urinary tract infections, and they may get skin problems because you're not washing off all the bacteria on the skin. So the problems with the daily living of a person with dementia may really become quite challenging for the spouse to manage at home without the help of either uh, private caregivers coming in from the outside, maybe a care manager who can help with finding out some community resources or things that the family can use in order to ameliorate some of these issues. But I think that, most of my families, except for the few and far in between, the ones that are at home, we eventually end up having this type of conversation. And and I think that, perhaps when it comes from a medical professional and I tell the family, hey, I see that you're really struggling a lot. And I remind them and I said, the data is not really supportive. The data is not in your favor. The studies show that those dementia caregivers that are either depressed or distressed about their role as a dementia caregiver have a 63% higher mortality rate. And I remind them, I said, if you're dead, you cannot help your loved one with dementia. And I think that sometimes that can help, even though, of course, even though I am a doctor, in my own family, I am just a son. And even though I mentioned that to my mom time and time again, um, it somehow never really sunk in. And he was never placed. He stayed at home until he was time for hospice care, and that's when he actually left the home, and then he died at the hospice house. But yeah, what a challenging time that was.
And I think also your mom was quite proud that she never placed your dad. And I'm mentioning that not that, listen, we're discussing, hey, when to place your loved one, because you can Google all of the, or even ask ChatGPT, it will list you all the 10 reasons why you should be placing your loved one. But I think the things that we're discussing are so complex because it's your family, it's your spouse, it's grief, as you said. And also, Pat Gutman in my interview with her was mentioning you're losing your confidence, your spouse, your best friend while he's still there. And to make logical decisions, so to say, is almost impossible. And I hope that whoever is listening, at least to realize that maybe if you feel, hey, I need to be doing better, like you say, daily activities, just bathing becomes very difficult. And I'm assuming that some people take it, I'm failing to do a good job. I just need to do better. Versus maybe it's at the stage when it's too much. And if I can get help, it will be better for my loved one and for me. Because the truth is, when all of us look at the facilities to imagine ourselves there, none of us want to go there. None of us want to have any family members in the facility. And yet there is still a benefit. Like again, thinking of my great grandmother, I think if there was a good facility, that would have been a gift to my family.
So, that brings up two good points. And the first one is, don't wait until the problems really become dramatic before you start looking. I think that if you're taking care of somebody with dementia at home, it is a good idea to begin to look early. It's a good idea um, to begin to see which facilities align more with you and with your loved one. Because, I think that ever since the pandemic happened, there's been a major shift in the assisted living facilities and with memory care units in terms of staffing. And I would say that most of the facilities, not all of them, but most of the facilities that I go to are definitely having staffing issues. And that is a problem because if you don't have enough staff members to take care of the people with dementia, things are definitely going to fall through the cracks. So I would say that that is one of the most important things that that we can do as you walk in the door is just to ask, hey, what is your staff to resident ratio? You know, how many people do you have taking care of, and how many residents are they in charge of? Ideally, it would be, one for every 4 or 5 residents. I mean, there are some facilities where I go to that the ratio is more like 1 in 10, some of them even 1 in 20, which is um, which is not good. You know, the other thing is, I feel that if you spend a little bit of time investigating which facilities are more accommodating to your loved one's autonomy and dignity, and you have a feeling that they have a little bit more to say about their care. Like, for example, some facilities only have meals certain hours of the day. Like they have breakfast between 7 and 9, and then after that, either your loved one eats breakfast around that time or there's no food. Uh, so also, bathing times. If your loved one always took showers in the evening, will they accommodate that? Will they make sure that your loved one is bathed around the time in which they are used to doing it? Is your loved one going? The word du jour is person-centered care. But Atul Gawande, in his book Being Mortal, brings up the concept of patient-directed care. Like, can things be done to encourage the ability of the person to continue to make some of their own decisions, to be able to feel like their identity is preserved, as opposed to being in a situation in which they have no choices at all. They have to eat what they have to eat. They don't seek out what their preferences in foods are. Everybody eats the same food. So to spend a little bit of time um, finding out what are the things that the facility does to accommodate the preferences. What do they do day in and day out to ensure that the patients have as much autonomy as they possibly can? Because the more autonomy they have, that kind of translates into dignity. And I think that in my experience, a lot of the problems with the unhappiness that people experience when they're in facilities is the loss of control, the loss of dignity, the loss of um, being able to make their own decisions, their loss to feel like the person that they're used to feeling like.
And we will make a whole podcast on how to choose a facility, how to go about this, because I think it's a whole topic on its own. But I think also what you point to, that taking that step, getting familiar with facilities, having a choice can be beneficial in two ways. And one, when it's getting hard and you may consider, hey, it's the time, you already have some idea of where your loved one will go. The other one, if there is emergency, like a fall or they left the house and you can't find them, you also have a place to go, and it's not emergency that the loved one will go anywhere where they have an empty bed, basically.
Mhm.
So, yeah, to take that step sounds very important.
Yeah, like for example, I think that everybody who's taking care of a person with dementia at home should be part of a dementia support group. And they are a great source of support, of knowledge, of friendship. It can be just beneficial in so many ways, including, for example, asking the other members in the group, "Hey, what are the good facilities in town? Do you know anything about this facility? Do you know anything about this other facility?" So asking providers like myself, or the primary care provider or nurse practitioner or care manager who may be involved in the case, to ask for information about what are the places where maybe the provider has other patients, where does he feel that his patients are getting the best care possible. So all those things are important, particularly before the emergency really happens. And of course, I mean, sometimes we cannot anticipate the emergency, but if you take my words and you heed them, just know that the time may come before you even realize it, that you may need to at least consider placing your loved one with dementia, in particular, again, for safety reasons, either for the patient or for the person caring for them.
Yeah, I wanted to mention support groups too, because even if we pivot back to the idea how hard it is to recognize that maybe it's time to place your family member in a facility, I would think that support group is also the place where speaking to other family members, other people who are going through the same experience, other people who maybe had to already face that decision, you may have a support, understanding, and just almost, how would say, be maybe seen in your problems. As I would refer again to Pat Gutman, how she said that there's nothing like caregiver seeing another caregiver. Like when they say one word and the other caregiver gets it.
Exactly.
So it's a great place to bring all of your problems and sharings. And that also, if we say, hey, how do you make that decision? It's a hard decision. I don't think we would be, hey, here's point A, here's point B. Go do that. It's a hard decision. So yeah, joining support group, online, in person, whatever you can find them. But join a support group. We humans can absolutely uplift each other and help each other to recognize something that we're not able to recognize on our own.
Yeah, that is such an important point, worth mentioning again. Don't go at it alone. Get some help. Educate yourself. Join a support group. Talk to other people. Talk to your providers about, you know, not only the challenges that your loved one is experiencing, but your own challenges. Make sure that you're taking care of your mental health, that you're getting some exercise, that you're eating, that you're sleeping. Listen, I just got reminded, I had a patient that finally, after not sleeping for almost 2 weeks and just breaking down completely in front of me because her loved one, it's so common for people with dementia to have circadian rhythm disruption, meaning that they're sleeping during the day and they're up at night. And so while her loved one with dementia was up roaming around the house, she was trying to sleep, but constantly worried about what was it that he was doing. So she wasn't getting any sleep at all. And this happened for weeks. And then, of course, during the day when he's sleeping, then she's got to be taking care of things, and running errands and running the house and going grocery shopping and doing all these kind of things. So, this idea of being aware of taking care of yourself, to not neglect your own needs because you are taking care of your loved one with dementia is of so much importance. I cannot um, emphasize it enough.
Yeah. And I think for some caregivers, just like for all of us, it's sometimes very hard to recognize our own needs. But if we remind ourselves that it is also good for other people around us. So if you're not taking care of yourself, you can't take care of your loved one. And if something happens to you, that would be very detrimental to your loved one too. So I think that reminder sometimes helps us to get more into gear and do something versus I just need to make it easier for myself. And I think it's a good note to conclude this discussion. But also, if you heard that we just spoke about falls and falls can be dangerous, we have a podcast where we discuss this topic, and you can click over here to watch that discussion. Please leave your comments in the video. If you know someone for whom this video would be helpful, please forward. It helps to spread the word, and hopefully, we all can live our life more fulfilled, even through the sorrows and joys.
Absolutely. Thank you so much for joining us, and we'll see you on the next podcast.